Thank you for your interest in biosculpture technology. I'll summarize what most investors want to know. While our Tier 2 Regulation A offering is qualifying, we cannot accept anything other than indications of interest. We believe our assumptions regarding the medical device market and the regulatory environment, as well as our timeline and projections, are both conservative and correct. However, we can give no assurance that we are right. BST operates as a lean medical device design specifier. We plan to offer three successfully prototyped products: the two on the left for the cosmetic liposuction market, and EVL on the right for the bariatric treatment market. The first generation proved the value of this technology, as it allowed Byron Medical and Mentor to capture approximately one quarter of the estimated 500 million per year power-assisted liposuction market it created. The device on the left, Airbrush 3, is the next generation of the device Mentor sold. Airbrush 2E in the middle is the next generation device of the version we currently sell, the FDA-cleared Airbrush 2. EVL on the right is our highest priority. It is designed for the endoscopic removal of visceral or belly fat as a disruptive, minimally invasive treatment of obesity, metabolic syndrome, and type 2 diabetes. It is protected by three blockading method and device patents, with additional patents pending. Persistent market research estimates the global bariatric surgery device market at 1.4 billion in 2014, with an almost 10% growth. It should reach 2.5 billion by 2020. McKinsey Global Institute reported the obesity-related disease expenditures to reach $2 trillion in 2014. Strong IP protection with proven revenue-generating ability remove enterprise risk. To remove execution risk, we will outsource to a large, experienced, ISO-certified OEM manufacturer who has given us an estimated 42-week development proposal. We'll emulate Lap-Band's successful subscription-based model and have the potential for cross-selling branded centers offering bariatric treatment, liposuction, and adipocyte-derived stem cell autografts. Management has established connections to the doctors who are key opinion leaders and a depth of professional, regulatory, and licensing experience. I'm Bob Cusin and serve as CEO. I created the power-assisted liposuction, or PAL, market with my very first tissue aspiration patent and founded BST to develop the more advanced designs. I'm a Cornell-trained, board-certified plastic and general surgeon. My published peer-reviewed research studies included animal and clinical studies in which I was principal investigator. My skill sets include an MBA from Columbia, 3 bar admissions, and 10 security licenses. Deborah Salerno is our CFO. She is a securities professional whose experience includes alternative public offerings and pipes. Simon Taylor serves as corporate counsel. He's a Harvard Law School graduate, experienced in startups and medical devices. Peter Cericioli is a Stanford PhD who serves as consultant engineer. Peter headed new product development at both General Electric and BAE West, and he has 4 patents under his own belt. Dr. Hughes is a Yale-educated ENT on staff at the Mass General. He is also a brigadier general who sits on the board of several public and private companies. Tom Perkowski is our patent attorney and also an engineer. Tom has successfully prosecuted over 650 patents, over 2 dozen for us. 2/3 of the U.S. population is overweight and 1/3 is frankly obese. McKinsey Global Institute estimates that 2.1 billion people are obese over the globe and forecasts half the population will be obese by 2030. The American Society of Plastic and Reconstructive Surgeons reports that nearly $14 billion was spent on cosmetic procedures in 2015, and that is up 5% from 2014. Nearly $2 trillion was spent on obesity-related diseases in 2015. We target both markets with products offering substantially more perceived benefits than current alternatives. The CT scan on the left, showing intra-abdominal visceral fat, or belly fat, is that of a hypertensive male. Aortic calcifications and nephrosclerosis indicate he is at risk for diabetes and a heart attack. Lipo can't help him, but he is a good candidate for EVL. The obese female on the right has a larger waist size, but she is much healthier as her fat is outside her abdomen. Her subcutaneous excess makes her an ideal candidate for Airbrush 2E liposuction. Airbrush 3 and Airbrush 2E on the left are cosmetic devices for small and medium to large volume liposuction, respectively. They will be marketed to plastic and cosmetic surgeons, dermatologists, and gynecologists who perform liposuction. EVL on the right is a treatment device to carry out endoscopic visceral lipectomy, or EVL, to address obesity, metabolic syndrome, and type 2 diabetes. It will be marketed to general and bariatric surgeons who perform endoscopic procedures. I created the power assisted liposuction, or PAL market, with a patent for the single cannula short stroke externally vibrating device as illustrated on the left. But I founded BST on the more versatile concept of a reciprocating tube within a tube long stroke device depicted on the right. It removes the drudgery and trauma of tissue aspiration by not requiring the surgeon to manually stroke the cannula back and forth, literally thousands of times per hour. And in use in liposuction, that unleashes the artist in the surgeon. Airbrush 3 targets the microwear PAL device in the middle, which has to be replaced every few years because of cumulative autoclaving wear. We plan to price Airbrush 3 approximately one-third cheaper with a projected 83% margin. Airbrush 3's podded coil design is subject to less vibration, a problem doctors complain of with the PAL device. Airbrush 2E on the left has a mechanical advantage superior to the hot poker tips posed by the ultrasound or laser devices on the right in treating fibrous areas and are at a similar price point to the ultrasound units. But our unit can't cause burns as the tips remain cool, and it is faster and less bloody. Further, it eliminates the need for the surgeon to stroke the device back and forth, eliminating the work from the procedure. Visceral fat causes gastric reflux and sleep apnea simply because of its bulk. It secretes deadly cytokines or cellular hormones which cause insatiable hunger and shut down the metabolic rate of the body. Its cellular hormones cause diabetes, hypertension, heart disease, autoimmune diseases, and cancers. Visceral fat is responsible for all the morbidities of obesity. It shortens your life and reduces its quality. Current surgical treatments for bariatric surgeons are either restrictive or bypass in nature and starve visceral fat to work. They stop the patient from eating too much or make food wind up in the toilet undigested. They pose serious surgical risks and have permanent lifestyle compromising consequences. And the patients eventually reach a weight loss plateau and start to regain. EVL will now make it possible to remove that visceral fat easily and safely, particularly the mesenteric fat, which is more detrimental. And unlike current alternatives, there will be no cutting into the bowel or stomach, no rearranging the body's alimentary plumbing, and no foreign bodies to leave behind. And EVL will not have the potential for creating nutritional cripples who live in the bathroom. It is anticipated approximately 10 pounds of belly fat will be removed permanently in an outpatient procedure. The patients are expected to get off the operating table with a lower blood pressure and a lower blood sugar, have more energy, and then lose an expected multiple of 7 to 10 times that amount in body fat in the ensuing 4 to 6 months. The procedure can be repeated until an ideal weight is obtained. Since removed fat cells don't grow back, should the patient continue to overeat, the fat will accumulate subcutaneously without the expected adverse metabolic consequences. Endoscopic visceral lipectomy, or EVL, is a patented procedure that uses BioSculpture technologies, also patented EVL device, and is performed laparoscopically through small incisions in the belly. The patients that would benefit from this procedure are known to be at a high risk for diabetes type 2. The small bowel mesentery of an obese patient is thickened with metabolically noxious fat. The surgeon targets central areas of the mesentery. Using the EVL device, the surgeon can safely and easily remove this fat without the need for to and fro stroking. EVL's patented tube within a tube device is gentler by design. As indicated in this slow motion video, samples are taken to determine which fat is the most metabolically detrimental and should be targeted for removal first. An EVO procedure may remove 4 liters or 8 to 10 pounds of fat, resulting in a lower risk of diabetes. It is anticipated patients will lose 7 to 10 pounds that amount in body fat within 4 to 6 months after the procedure. Priority will be placed on bringing the EVL device to market within 1 year. We target having a new 510K substantially equivalent to our last 510K for removing soft tissue and fluid from the body in general surgical procedures, including suction lipoplasty for aesthetic body contouring, in approximately 42 weeks from funding. We'll immediately do 25 patients and apply for a modified 510K to add, including visceral lipectomy as an indication. Airbrush 2 and Airbrush 3 come online in the 5th quarter from funding, and it is anticipated integrated airbrush fat collecting devices for autografting will be added in the 6th quarter. In approximately 7 quarters from funding, we should have done sufficient patients to support efficacy claims for visceral lipectomy so the procedure may be reimbursed by insurance companies as a treatment of obesity, metabolic syndrome, and type 2 diabetes. I'll use my personal contacts to facilitate placing first systems with key opinion leaders at major hospitals where efficacy studies can be performed. We'll have company-paid sales managers on each coast and independent reps in between, fed leads from trade shows and rifle barrel advertising in trade magazines. Abroad, we'll use distributors. Cooperative advertising promotions and incentives will multiply the impact of our advertising budget and establish our brands, similar to the Intel Inside branding campaign. Method patents allow brand-based referrals and the licensing of branded treatment centers. These centers can effectively cross-sell EVL, liposuction, and fat autografting for wrinkle and scar correction. Bottom-up projections are based on EVL being sold only on label, only as a liposuction device until regulatory approvals and sufficient patients could have been done to support efficacy claims and obtain insurance reimbursement. This conservative pro forma was run out uniformly at only 20% growth, including after procedure reimbursement might be obtained, and initial international sales initially at just 50% of domestic sales. It gets us to $2 million EBITDA 24 months from funding and approximately 44 million gross sales 4.5 years from funding. To get an idea of how conservative these projections are and how vast is the market, just treating 1% of the 20 million diagnosed type 2 diabetics in the U.S. alone would yield 104 million in net income. And that diagnosed type 2 diabetic market grows by $750 million each year. We're offering approximately 1/5 of the company for $5 million in this Tier 2 Regulation A offering. We plan to list first on the OTCQX and then move to NASDAQ. As expected, 1/3 of the funds will go towards production and regulatory expenses, with an estimated time to market of 12 months. 1/3 will go towards corporate infrastructure, and 1/3 will go to promotion and marketing. To recap, we have the 4 pillars of a sound investment: a humongous and literally burgeoning market, a viable practice business model with patent-protected barriers to entry, IP of proven revenue-generating potential, and a short time to market. The growth strategy is the proven one of Lap-Band's subscription-based model, plus branded center cross-selling opportunities. Our management team has established personal connections to the medical market and a depth of professional, regulatory, and licensing experience. Thank you very much for listening.